Hello everyone, very good morning. This is Kranti Balla. Today's topic in exercise science is all about blood pressure. What are the risk factors associated with high blood pressure? And the obvious question is, how does exercise regulate blood pressure? Blood pressure is the force through which the blood flows to the blood vessels, carrying oxygen and nutrients to different parts of the body. The blood pressure range in a healthy individual is 120 mm by 80 mm. 120 mm is taken as the systolic blood pressure and 80 mm is taken as the diastolic blood pressure. When the heart contracts, the blood is pumped into the blood vessels. Therefore, a series of contractions at a given time point is taken as systolic blood pressure. When the heart relaxes, more volume of blood gets filled into the heart chambers. Therefore, a series of relaxations at a given time point is taken as diastolic blood pressure. When the blood pressure range in an individual exceeds 140 mm by 90 mm, the individual is said to be hypertensive. When the blood pressure range falls in between 120 to 139 mm and 80 to 89 mm, the individual is said to be prehypertensive. So the next obvious question is, what are the risk factors associated with high blood pressure? High blood pressure can have devastating effects on the health of an individual. The functioning of various organs in your body very much depend upon the supply of blood through the blood vessels. Blood vessels are strong, elastic, flexible in nature through which blood flows and reaches the target organs. The inner lining of these blood vessels is very thin and soft. High blood pressure can in fact damage this thin inner lining, and any kind of damage to these blood vessels will restrict the blood flow to the target organs, as a result of which it will lead to organ dysfunction. High blood pressure can have a lot of damaging effects on your eyes. It can result in kidney failure, it can result in heart and brain stroke, and it can also lead to sexual dysfunction. This clearly tells us that high blood pressure has a lot of deleterious effects on the health of an individual. Therefore, apart from medication, doctors do recommend a low to moderate intensity exercise to individuals who are both hypertensive as well as prehypertensive. So the next important question is, how does exercise regulate blood pressure? In my previous video, we clearly discussed that a good cardio activity can enhance the functional working capacity of your heart and lungs. You basically train your heart and lungs to perform at higher intensities as and when it is required. But then, how does this physiological adaptation happen? A study published in a journal, Frontiers in Vascular Medicine, clearly tells us that exercise can bring in cardiac myotrophy and it can also lower the resting heart rate. Let me explain this in simple terms. In well trained individuals or in individuals who engage in regular cardio activity, the heart is slightly enlarged. Due to increase in the size of the heart chamber, more volume of blood gets filled into the heart. Therefore, for every contraction, there's also more volume of blood that is pumped out into the blood vessels. That means to say that the stroke volume or the cardiac output increases. Say, for example, your body needs X ml of blood at a given time point. So, lesser number of contractions are good enough to supply this X ml of blood because your cardiac output increases. Therefore, your heart doesn't have to beat faster to supply the required amount of blood to your body. This tells us that exercise basically lowers your resting heart rate. When your heart rate decreases, obviously the force with which the blood flows to the blood vessels also decreases. That means your blood pressure also decreases. So, to summarize, I can say that exercise brings in cardiac myotrophy, your heart enlarges in size, there's more volume of blood flowing out into the blood vessels for every contraction. So lesser number of contractions are good enough to supply the required volume of blood to your body. Lesser contractions indicate a lesser heart rate. When there is a lesser heart rate, the force with which the blood flows into the blood vessels also decreases. That is, your blood pressure also decreases. Therefore, controlling blood pressure is all in your hands. Small changes in your diet, like reduced salt intake, or engaging yourself in good cardio activities like brisk walk, slow jog, and cycling can effectively reduce blood pressure in both hypertensive individuals, and it can also regulate blood pressure in healthy individuals. If you find the video to be informative, Please do share it with your family and friends. Have a happy weekend. Thank you so much.